Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. Tonight, we're going to be talking about holistic healing and something new that I'm just learning about, and it's called HeartMath therapy. And our guest is Agnieszka Tarnawska.
Correct.
Welcome, Agnieszka.
Thank you so much. I'm happy to be here.
So first, we chatted a little bit, but you've got a fascinating personal story. I love getting to know people. So tell us a little bit about you. Where were you born?
Well, yes, I come from Poland.
From Poland.
I grew up in Poland,
Okay.
and then life brought me here and studying a little abroad. But yes, right now I'm here in the United States.
And one of the things that really fascinated me about you is that you have a real deep-seated interest and knowledge in science, in hard science, and then you've expanded that into kind of these healing arts. That's the way I would describe it. So when you were growing up as a young child, did you live in a city or did you live in a rural area, a small town? What sort of an environment did you grow up in?
Yes, so I grew up in the suburbs next to a real forest, which was my playground, literally, for many, many years. My parents being a biologist and my father a forestry engineer kind of instilled within me that love for the nature, although I'm not even sure if anyone instills it, it just comes naturally.
Right.
But I was surrounded by it, definitely thanks to them and their love to the nature. And I always had that desire in my heart to heal, help in healing, but I wanted to do it in a very natural way.
Mm-hmm. And I understand that when you started a college, your parents biology and engineering, and you had this affinity to nature that you studied climate and environmental sciences. Would that be the best way to describe it?
Yes, so I became an engineer and master in environmental protection.
Okay.
And that was because at the time I couldn't find any studies that would actually be more directed into non-conventional medicine.
Mm-hmm.
So I chose the environment and to go in that direction, which became for almost 2 decades my career, professional career.
And describe a little bit what that career was in as an environmental engineer. What type of projects did you work on?
Right. So I engaged into the projects of greenhouse gases mitigation, projects that would generate the carbon credits. And I started working on those kind of projects in Poland. And then I continued in Colombia, South America, and then here.
And what was when you came to the United States as an environmental engineer, what were some of the projects that you worked on here in the U.S.?
Yes, I was developing the greenhouse gases emissions inventories for the city of Winter Park in Florida. For a couple of years. In between that, I was also involved in projects of energy efficiency and other projects, that were related to sustainable development of the city.
Well, fascinating. We could have a whole show about that. But the reason you're here with us tonight is to talk about holistic healing and a new program that, at least new to me, which I would maybe describe as kind of like biofeedback for holistic healing. How did you develop an interest as an environmental engineer in the healing arts, holistic healing?
Well, yes. So as I mentioned, I worked in many of the energy efficiency projects. And I like to think about it as now bringing that efficiency to a personal level.
Okay.
We are energy beings,
Mm-hmm.
and the HeartMath is all about if we speak on the level of the energy, it's about the intelligent management of your own personal life energy. So When I get that question, and I get it quite a lot, what does the engineer do with the holistic healing? I would say that the science behind it really fascinated me, and it makes so much sense to me. And yes, and as energetic beings, it makes sense that we need to somehow manage that energy so we do not end up depleted by the end of the day, but rather have the balanced expenditure of that energy with mechanisms to rejuvenate us.
So maybe educate me a bit. So I'm thinking of energy in two different ways. So I'm thinking of it sort of in the what I would describe as the Western way of you eat calories and you do work that expends calories, and that's one way of thinking of energy. But in my mind, I'm also thinking of the phrase energy as chi, or more of an Eastern flow of energy through the body, which I'm sure there's some similarities, but I think of that as different than just the watts and joules of calories in and calories out. Is there a relationship between the Eastern energy of chi and what I'm probably incorrectly describing as the Western energy of calories in and calories out?
I think it all is very much connected because, let's say, in Eastern tradition, we speak about the energy as the life force, something that beats our hearts, the energy that is necessary for our metabolism, the whole body to function. Everything is based on energy. Our physical movement obviously is energy, and that's what you are bringing here to the point. Like, we are moving, we are expanding that energy through our physical movement, but also our thoughts, feelings, emotions. They're all a form of energy.
They all require energy.
They are all form of energy. So yes, you're right. Then we are, let's say, rejuvenating and recharging ourselves. If we thought about ourselves as this battery of energy that is being recharged, and then we use that energy throughout the day, throughout the activities. One of the mechanisms to recharge ourselves is through the sleep, but another entry is through the food that we eat. We absorb the life energy that is actually present in the food. That's what we talked about the living food, green food, right?
Sure.
Versus
The
something that is very
sun
processed.
and
Yes.
photosynthesis and the plants that we either eat directly or we feed the plants to the animals, and then we eat the animals kind of that have processed.
Yes. So, but the point is that we are absorbing the energy at the basic understanding of it. So the more of the life energy that food has, less processed it is, the better for us. And I think these days there's a lot of conversation about it, right?
What was in terms of the general topic of holistic healing, what would you say was your first personal experience with something that fits into that category?
You mean in my personal healing?
Yeah, like was it yoga? Was it meditation? Was it just sitting in a forest and what we might now use the term forest bathing to describe, but you might have done it. I mean, I can remember growing up as a kid sitting in a forest, for a while, long before I ever knew that was perhaps a form of holistic healing.
Yes. So if we go that far back in the childhood, definitely I was going to the forest to hug the trees. I could sense their energy flow. And anytime I would be slightly, let's say, congested, I would feel that perhaps I'm getting sick. I would go for a walk to the forest, to the pine forest. And, what the trees, like the etheric substances that they, what's the word?
So they emit.
Thank you. Yes,
and
we can breathe
absorbing
in.
it through our skin, through our lungs, through
and
our...
I realized that this was really healing, and I would benefit from it. But later on, like the closest to the path that I'm on today is really the healing of yoga with the meditation, with the visualization, like all connected. That became my practice for many years, and it proved to me its healing abilities quite many times.
And was that something you were exposed to in grade school or high school or college, or was that something that you sought out after you were out of college and working?
You know, often it comes around this way, that when you see that something is not working very well physically in you,
Time to make a change, and
time to make a change and look
you're
for
a wisdom
the
seeker, seeking
Yes.
out some other ways of doing things.
Yes, but the difference perhaps was that I was always looking to non-conventional rather than conventional. I had that understanding that whatever is not manifesting well has a reason within. And I was searching more for the ways of how can I heal myself from within.
Mm-hmm.
And of course, not rejecting any outer help of conventional medicine if it were necessary,
Yeah.
but always trying to go through a non-conventional way, naturally.
Yes.
Healing.
I think kind of the Western way for most people before they become familiar with holistic is you seek a medication. Can you get a medicine to help with the stuffiness, a medicine to help with the sleep, a medicine to help with the achiness, and whether it's a prescribed medicine or one of the millions of medicines you can buy over the counter or online.
Yes.
But at some point, many of us feel like, gosh, you get a medicine and then you need a medicine for the side effects of the medicine you take, and we get this natural inclination to what can we do more naturally.
Yes. So I like to think about this again, coming back to the energy and how it acts within us. I like to understand it in that expenditure of energy in 4 planes: physical, emotional, mental, and spiritual. And I think that many different modalities, and particularly our conventional medicine, found that entry, particularly through the physical domain, I would say, to heal. Not that all 4 of them are interacting between each other. Like if we feel mentally or emotionally not well, that affects our learning ability, right? How we physically feel. So everything is interconnected, but let's say each modality would have this specific entry. And it's nice to really reconnect it with the modalities that can bring the entry through the emotional, mental. Spiritual, it's more of a personal choice, but it follows when all other 3 are brought into a holistic healing. So for me, it's a connection between those 3 and the spiritual as a personal choice.
And as you describe that, I wonder, are there certain modalities of holistic healing that
but at that point, let's say I was just leaning on myself, and I was going through this journey, guided by, let's say, like intuitive voice within me. And then, like I say, a couple years later, to educate myself better, to be able to bring it to the people, I enrolled first as a pre-requirement for the studies as a yoga therapist. I became a yoga teacher. Then I became yoga therapist. And in the midst of that all, I enrolled in certified programs of HeartMath Institute, and did there 3 certificates. And then I felt just like at the beginning of this whole journey, and I enrolled in a school for to learn Ayurveda.
Okay. And describe a little bit the difference between being a yoga instructor and being a yoga therapist.
Right. So in a school for yoga therapists, we definitely learn more about how to apply certain modalities of yoga. And I'm not just talking about the asanas, postures. It's the breathing techniques, it's meditative techniques, and how to apply them in a specific situation that a person may be going through, maybe at. So with the anatomy, physiology, and studying deeper into different let's say diseases that exist, how we can be of help in a very gentle, non-invasive way, and bringing that not only physical but also emotional and mental support.
And since this is a cancer education series, so we've got patients that come to our programming that might have just been diagnosed and are getting started with treatment. That could be surgery, chemotherapy, radiation. We've got patients that are in the middle of treatment. We've got patients that are done with treatment.
Right.
We've got also patients who are living with incurable cancer. From a yoga therapist perspective, what would you inquire of someone who comes to you who, let's say, is in the midst of cancer treatment and wants to bring this type of holistic healing onto their team in addition to sort of the conventional cancer treatment? What sort of questions would you ask, and how would you design a holistic program that would help someone who is a cancer patient or a cancer survivor?
Right. So the way I see it, and with the clients that I see, the people that come for help, I usually start and like to work with very much with the HeartMath because it brings that emotional component and ability to cope with stress. And many of these people, I think, go through a lot of emotional stress, anxiety, perhaps fear, and besides the movement. So of course, asking like if there are any restrictions of the movement and how can we safely apply some of the poses of yoga, bring to it breathing and kind of a meditative state. And definitely I include it in the HeartMath. And the building ability for people, empowering them in self-regulating their emotions and behaviors in response to the stressful situation. And I think that brings a lot of support. And if we talk a little bit more about the HeartMath and how it really helps to activate those more harmonious heart rhythms, which support the body's natural healing processes, I think that this brings quite a lot in connection as this holistic healing to the conventional treatment, whatever that would be. So the person doesn't need to expect any long questionnaire of neither talk about the specific problems. It's enough that we meet and start shifting that, let's say, emotional response that the person have to more rejuvenating one, and helping the person to do that.
Okay.
With some movement, of course. And breathing. And
Well, let's talk about HeartMath. We've had other guests on the show that have talked about yoga and meditation and breathing, but we've never had anyone talk about HeartMath. And so, for those who might not be hearing me, math like algebra is what we're saying, HeartMath. And so, tell us a little bit about what is HeartMath in its essence, and then I think we're going to do a little bit of a demonstration.
yes,
So I've not actually done the demonstration. In my mind, again, I'm kind of thinking of biofeedback. I can remember we've had guests talking about biofeedback where you might focus on heart rate, or you might focus on the temperature of your fingers. How would you compare and contrast, or just tell us what is HeartMath, and then maybe we'll get a demonstration of that.
right. In few words, HeartMath system, like I said before, empowers people in their ability to self-regulate emotions and behaviors, meeting the stressful situations, facing the stressful situations, helps build personal resilience. And I will talk more about like what's all behind this, and also tapping into, let's say, finding the way, personal way to tap into this natural intuitive wisdom within. And that helps people to bring more balance to their personal business life and health and overall well-being. But what really stands behind scientifically behind the HeartMath. HeartMath is an institute that for 30 years, close to 30 years, dedicated their research and study to heart coherence and optimal functioning of the human body. And what, yes.
And just to clarify, you really are talking about the human heart,
yes,
the pump of the blood. We're not using the phrase heart as a euphemism for passion or emotions. We're actually talking about, correct me if I'm wrong, but the interplay of our emotions with the functioning of this human pump that has an electrical system and a mechanical system.
Yes. So actually it's both. But we do come out from definitely from the heart as an organ, as a pumping blood organ. And what the science discovered is that when we place our attention on our physical heart, I mean, it doesn't mean that we imagine how it looks, just we are aware of our heart. A measurable change is happening in the rhythms of the heart, and they become more harmonious. So in other words, to explain it, is that the heart, even in that resting state right now as I'm sitting, does not beat like a metronome.
There's some variability,
yes,
to
exactly.
the heart rate. It's
yes,
not just steady.
It's not like a metronome.
Unless
no.
you happen to have a pacemaker and rely on that.
Yes, naturally
but
speaking.
the natural pacemaker has some variability.
Yes, and it's actually called heart rate variability. And what the scientists discovered is that this variability, the changes, can actually form a pattern. And then when we place our attention on the heart and breathe a little slower and deeper, we induce or activate, I would rather say, more harmonious heart rate rhythms, and they literally look like a sinusoidal wave.
Like a sine wave. If you were to graph it on a screen, you can see those changes.
But that's the coherent one.
Okay.
So the scientists also discovered that the emotions play a very important role in activating that state of heart coherence, meaning that when we are, let's say, in a state of stressful reaction, a reaction to a stressor, being, be it anger, fear, sadness.
Yeah, we all
worry.
can fear that.
Yes.
Feel that. We can all feel all of a sudden our heart rate kicks up and we can feel a more intense pounding.
Yes. So what happens to that beautiful wave? It is very it's very, it looks like almost like an earthquake on the screen.
Like an earthquake. Is that what you said?
Almost,
Yeah.
yes,
Yeah.
almost
So
like an
very
earthquake.
erratic, sharp.
Yes, yes,
You don't have the nice rounded, you have sharp peaks and valleys.
yes. So it looks very much disorganized. And again, through the technique, when we place our attention on the heart, we breathe a little slower and deeper,
Mhm.
and then even bring to it the attention or focus on some rejuvenating emotion, which can be joy, love, appreciation, care, kindness. These rhythms actually smooth out and become more coherent. And why is that important? Because that coherence, that signal from the heart is being communicated to the brain. And actually, heart sends more information to the brain than receives back. And that's what the scientists also confirm. It's more of the upflowing information that coming down, which brings the importance to the information that the heart really sends. And when that more harmonious, coherent heart rhythm is being communicated to the brain and through the brain to the rest of the body, it's almost like on a cellular level, each cell feels that harmony, feels that coherence. And we can answer that question to ourselves, like in which environment that earthquake looking like, or that more harmonious like, the cell, each cell of our body, each organ of our body and system can perform its function better.
So I think what I'm hearing you say is that we can use our consciousness to affect the beating of our heart, and the pattern of the beating of our heart can then affect our emotions and our whole cellular integrity.
Yes, the emotions affect us on beat to beat basis, right? But if we focus, let's say, if we focus our attention on something rejuvenating and practice that focus, keep that focus on it, meanwhile we also focus our attention on the heart, we can induce those more harmonious rhythms, which then affect us in a very beneficial way, the entire body, and can support this way the healing on anything that is going in our body.
And is seeing a visual display of our heart rate and variability, is that a necessary part, or does that just allow us to learn and get the feedback to feel it more quickly and become better at it?
Correct. So biofeedback is just a tool that helps to observe it. Meanwhile, one is doing that technique and learning how that feels. Learning how that feels within the body. So when you walk out, you can remember that feeling, knowing like having that assurance, like I know that this is the right feeling that I have, and I'm doing something to support my healing, right? To support my overall well-being. So it is an educational tool. We don't need to carry it all the time, and it doesn't mean we can enter that state only hooked up to the technology. But it's a very helpful thing, and even with the interactive games for children, to teach them to enter that state, even though the children dwell in that state more
And naturally
naturally.
do it.
Yes,
Right.
but it's important to teach them that whenever they feel in this that they are in distress, they can help themselves by doing this simple technique. And please don't be dismayed by the simplicity of these techniques, because there's really a science that supports that, something that simple as focusing the attention on the heart.
Sure.
And,
yeah. Well, it's pretty, I mean, it's quite intuitive. I mean, we talked about, I mean, you step outside to take the garbage out, and a dog barks at you. I mean, you feel immediately that increase in heart rate. You feel probably increase in blood pressure, pumping. I would say maybe the positive things, like you do a yoga class, and at the end, you're in the corpse pose, and you feel this peacefulness come over you, but it's not as easy to feel the heart rate at that point. And visualization would probably confirm what we already just sense we're feeling.
Oh, yes, definitely, because this is our natural state of
Mhm.
being. We are
Well,
just
why
being.
don't we
Yes.
do some demonstration?
Yes,
So let's go ahead and get set up here. And so bear with us, you guys that are watching us. We're going to set up the computer here, and we've got a little sensor that's going to sense my heart rate through my ear, correct? Yeah. And does it matter which ear I attach it to?
No.
Is it okay? It's not like the left ear is closer to the heart and is better. No.
No. So I will bring the chair to.
Okay.
Because I would like to narrate a couple of. I'm not sure how well visible it is.
Yeah.
To our audience.
And so we have a live studio audience. We also have you that are watching live streaming. So our cameraman will bring a close up. And if those of you in the room want to get closer, please bring your chairs closer if you want to see the screen. If you can't see it very well from where you are. Okay.
Okay. So I will just narrate and guide you what we'll be doing here. So this is the screen of the program where we'll observe the heart rate variability and the pattern that is forming. So
It looks like I'm flatlined.
no. I haven't pressed the
Oh,
start
okay,
button
good.
yet.
I was getting a little worried.
No, we will see in the bottom. In the bottom, we will see
Okay.
the pulse if it's detected. Here we go. And then on the upper screen, you would start seeing, the differences between each heartbeat. It's translated into another, let's say, graphic presentation that shows those waves about which I was speaking earlier.
And is that the amplitude, or is that this is the electrical, the heartbeat? Can it sense the force of contraction?
So it senses the heartbeat, and then recalculates, let's say, the differences between each heartbeat.
In terms of variability of
Yes,
the
and it shows
time
it on
between each beat.
Yes, and shows it as a changing pattern. So let's say this difference between one beat and another, how many of those would happen in 1 minute, then the next one, and it just basically when it goes up, the heart is accelerating, and when it slows down, it comes down.
Okay.
So it's just that wave. So as we see right now, it doesn't show yet the pattern that we are seeing, but at the bottom you can also see the presentation of that heart rate variability and how high, let's say, it is. So right now it's already raising. So the higher it raises, the more harmony there is in between those changes. This pattern becomes more harmonious. Let's say it forms more harmonious wave. So I will guide you all if you'd like to participate in the technique, and we will see how your heart responds to that technique.
Yeah, I'm game.
Yes, and I would advise not to move too much during it, because the sensor also picks up all the other movements and waves that are created in the body. If you'd like to place your hand on your heart, that helps, but it's not necessary, but it helps. Focus your attention in your heart. Imagine your breath is flowing in and out of your heart or chest area. Breathing a little slower and deeper than usual. Find an easy rhythm that is comfortable for you. make a sincere attempt to experience a regenerative feeling, such as compassion or care for someone or something in your life. Keep breathing in and out. Keep your focus on the heart. Keep focusing on your heart. Breathing in and out. So, as you can notice already, and if you'd like to open your eyes, keeping that focus on your heart, the rhythm of your heart became more coherent, and it's happening almost within splits of seconds, sometimes longer, depending what is the situation we are going through. But again, it's our natural state of being. So it seems like when we focus our attention and shift that rejuvenating emotion, our heart responds very quickly to it by harmonizing its own rhythm. So as you can see, the waves became smoother. And it's beautiful that a person can actually watch it meanwhile doing the technique, because then you can observe what is that feeling within you, and versus what is happening on the screen teaching you, aha, now I'm in that state, that's how it feels. We naturally know how it feels when we are joyous, we feel good within, but it's yet another thing to observe it and kind of going through a regular day with regular emotions, and how do I shift my attention, how do I keep my focus to be able to maintain that state, right? And of course the simplicity of it is obvious, right? But what makes a difference is how often we practice, how regularly we practice. And again, the studies show that that we can build a habit of reacting to the stressor from a place of more composure and peace. It takes a practice, right? It takes time. But again, uh, our reaction, so situations are not themselves, the cause of our stress. It's rather our attitude towards that stressor. And it's a good news, because we can't control the outer conditions as much as we can help ourselves through learning this very simple practice.
And to what extent is what we're doing connected to mindfulness? Like by you giving me some guidance as to what to do, I'm more likely here and now, as opposed to thinking about the flight that was late on coming here from DC and what might happen when I get out of here. To what extent is this exercise also an exercise of mindfulness?
Yes, it is. Definitely is. It's almost, you can even think about it as a contemplative practice,
Mhm.
right? Because you consciously choose being aware how you feel in a given moment, or just wanting to do the technique as a regular practice, and you do it by maintaining that focus, and this is your choice. What you want to contemplate, that is a heartfelt, heartborn feeling,
Mhm.
right? And just focusing on that and shifting your attention from withdrawing it from something that is disturbing, or just continuous rushing through the day, into something that is more rejuvenating you.
Mhm.
It's very beneficial to your body, and to support. Let's in a way, we are building a terrain for the body to do well what it's designed to do,
And I know
right?
that we're focusing a bit on variability, but is it also true that the deeply contemplative state also results in a slower heart rate in addition to the variability, or are those totally unconnected?
No, and actually, that's a very good point. I would like to speak to it, that uh, these techniques do they are not like uh, many other meditative techniques, let's say, because what we are doing here, and consciously shifting the attention to rejuvenating emotion and keeping that focus, we are actually not intending to slow down our heart rate. Of course, if it's racing, it will just
Mhm.
rather go into its natural peaceful state, but it's more of a state of active calm.
Active
That
calm.
active calm, that's why we can use this technique meanwhile we are driving a car.
Mhm.
We can do it meanwhile we are
Mhm.
cooking, teaching,
Mhm.
having a visit with a patient. We can do it absolutely anywhere. Meanwhile, we become aware, and we have an intention to do this technique, and that supports the clarity, because these more harmonious heart rhythms facilitate the activity of the brain,
Okay.
instilling the peace that we feel, more clarity,
Mhm.
more composure.
And in a practice, so I think I'm hearing you say that part of it is just like we might do mindfulness during the day, like where we have the opportunity between a stimulus and an action to take time to pause, that we can do this. But if one were to do a practice like sitting in front of the computer and watching this, and using this as a instant feedback, would there be an optimal duration of time at which one might include this in the practice?
Yes, so um, one can start from anywhere between 1 to 3 minutes,
Mm.
maybe twice a day, to start seeing, and you have immediate, let's say, benefit, but doing it regularly
Mhm.
will build a habit. And there is estimated through the research that an average person builds a habit within 6 weeks, but of course that depends on the intensity of the practice, and many other factors, but on average 6 weeks. So let's say you do this practice twice a day, between 1 to 3 minutes, for about 6 weeks, and and through this process you will also see the benefit, the changes, and in your way of responding to different situations. But also it builds, I would say, lifelong skill to be able to manage the emotions. And we may notice that through that practice, the stressors that would cause us the heart palpitation, or other ways how we react habitually sometimes to the stressor, you may find out that this doesn't have such a hard grip on you anymore.
And are there studies that you can point to that, getting back to this Western evidence-based medicine, where studies have been done on HeartMath,
Yes.
and what are the objective benefits that one has seen in doing studies using HeartMath in either a randomized prospective trial or just as a demonstration.
Yes, so there is more than or close to 400 research studies that are free to access on the website of heartmath.org directly in their library, and it's a wonderful resource for anything related to not only HeartMath itself, but the whole area of, let's say, coherence of the heart and optimal functioning. So that's one resource that one can look at. But talking about the benefits of practice of these techniques, you are also asking like what's the
and just in your own words, I mean, I would say that I suspect it shows a greater sense of excuse me,
bless you,
of calm,
oh yes,
decreased anxiety, maybe decreased sensation, a greater feeling of joy. I mean, those would be some things that I might expect a study to show.
Right, and there is even much more beyond that, because the studies show the increase in our learning ability,
Okay.
Our ability to focus, stay composed, clarity of mind. Yes, of course, reducing anxiety, helping with the sleeping disorders, chronic pain, PTSD.
Okay. How about heart physiology? Can it be used to help reduce blood pressure?
Yes.
If you have abnormal blood pressure. And can anyone ever use this as a form of treatment for cardiac arrhythmia, for example, atrial fibrillation? Do we have the ability to have our mind help control heart rhythm abnormalities?
Yes. So there's a very interesting scientific fact that when we induce that heart coherence, other systems in our body are pulled into that coherence as well, including the blood pressure, even respiration. At the beginning, we use the breathing to help induce that state, but after that, it becomes synchronized on its own. So yes, if we think about it, that the heart coherence is let's say pulling into coherence the rest of our body, and it becomes like a global body coherence, we can support this way different states of health or disease that we have.
Sure. I mean, it would be easy to understand how our heart rhythm can affect everything from kidney function to just, I mean, every cell can feel that rhythm. And
yes, and I like to think about it this way, that even though we do not sometimes have the research that points exactly to a specific disease, I like to think about it that it supports the overall healing, and the body has its own intelligence. It's like the baby developing, like we are not doing this physically. It's the intelligence that guides this whole process, and whatever requires healing in the body, doing these techniques, we can naturally build that terrain that supports that healing to happen.
And as you talk about the baby, so one thing that comes to mind, and it just comes to mind, I can't give you a talk about it, but one of the when a mother is in labor, one of the things that is done is to check on the baby's pulse, and heart rate variability is a positive thing. And I just kind of wonder whether that phenomenon and the relationship of the fetal heart rate variability on health, if there's something in common with what you're talking about.
Definitely. I mean, we all have that heart rate variability, and it's a good thing to have. Whether we sleep, whether we walk, we talk, whatever we are doing, we have it. And actually, the more we have it, the let's say the better. It's almost like an indicator of our biological age and what
kind of an
our
optimal
condition,
state.
yes, and what our current condition is. And yes, and there's another very interesting fact about the heart, that it generates the electromagnetic field. And
Mhm.
like almost
So
like
it might
the cell
affect
phones,
people near us.
definitely.
Right. There
Definitely,
can
it's
be
like the
this
wave of the
contagiousness of joy that could happen.
yes, exactly. So like those ancient truths, like what you give in, you receive. You receive back what you share with the environment around you. And there's a study that actually shows that the coherence of your heart can help another heart
Mhm. Yeah.
to come to that coherence as well.
Sure. And I
So
think every mother has held a child, or every mother or father that's
yes,
held
we
a
intuitively know
child.
that.
So Agnieszka, we only have about 5 minutes left. I can't believe that. So let's open it up to a few questions.
Definitely.
So we have a live studio audience, and we also have those of you that are watching us live streaming. If any of you watching live streaming have a question, just put it in the comments section. We'll monitor that, and we'll go to the live studio audience first.
Hi, I'm Angelina. So I'm really, so how do you get that? Are you able to get that program and utilize it at home?
Yeah, before we'll end, we'll talk to you how you
We can get
can
it? Okay.
access HeartMath therapy, HeartMath practice.
Yes, I would. Well, we call it. We can call it training or coaching, mentoring,
Okay.
But I think the therapy is quite a nice word to use
Okay.
with it as well.
Okay.
So yes, on one hand, yes, you can purchase this program and you can use it on your own. There's another device that works that doesn't have this particular program, but it has an app that shows you your heart coherence and shows you the practice, how in the progress of it. And it's available through the HeartMath website. That's definitely. And for those who, let's say, do not want to invest in a program like this, or spend or thinking like, I'm not going to use it for a longer time, I just need to learn and see how it works, and I'm fine with this, you're welcome to come to our clinic. And we are offering this coaching, the HeartMath coaching, with a lot of more said about this and the application of these techniques in everyday's life. And so there are
Agnieszka,
two ways of doing it.
What
yes.
is your clinic?
Brief physical therapy and wellness.
BREATHE.
Yes.
Breathe.
Yes, and there are 3 locations. And yes, if you
and
can.
the website is breathe.
ptw.com, physical therapy and wellness.com. So briefptw.com.
breatheptw.com. So
Yes.
that's where you can get more information
Yes.
if you want to go to the clinic.
I do have a question about the yoga part, meditation. I do agree it works, but I did it through YouTube when I was dealing with my cancer. I mean, I was in a PET scan and they said, "Oh, your blood pressure is high and your A1C, I mean, your blood sugar is high." And I'm like, "Well, yeah, I'm nervous." And she says, the doctor says, "We can't do it until we can bring it down to 170," because it was at 210, my blood sugar. And I said, "Leave me alone for 10 minutes. I'm going to meditate." And I used something from YouTube and I brought it down to 170. She was amazed, the mind over body thing. And I said, "So am I good? Can I do the PET scan?" She goes, "Well, yeah, but I would love to take you to a casino if you can do that on the slot machines." And I went, "No, I'm not that good." But I do believe. But is there anything on the YouTube that you would recommend that does the same kind of, for people that want to meditate? Is there any particular YouTube that you've seen that benefits?
There's so much out there that is available. I don't think I have any particular one.
So Agnieszka, when you started doing yoga as your first holistic practice after your first child, what did you use? You said you did it at home.
Yes, my 2 books with which ones I worked were Yoga for Depression by Amy Weintraub.
Okay.
And then there was another one that was Kripalu Yoga.
And that was Amy Weintraub, not Amy Winehouse.
No. And did I say it wrong?
No, you didn't. I just wanted to clarify.
And yes, and and the other one was Kripalu Yoga. And like I said, I was not at the in the place that I
Okay.
could go out to the studios.
So we have one more question here, Kevin, and then do we have a question online too?
Raises a lot of a cancer diagnosis produces a lot of anxiety.
Yes.
Have you worked with any groups as such or individuals who have initial diagnosis with all that anxiety in an attempt to reduce that anxiety for them before they even start treatment?
Yes. So I know that those practices are offered to people that are going through different stages, right, of whether it's cancer or other diseases. In my personal experience, I had clients that came that were after the treatment already, but also dealing with the, let's say, fear and anxiety, worry, and maybe even depression. Right. So in person, I didn't work yet with the clients that would be in that earlier phase of the treatment. But I know that others work on it, and it shows, and the studies show that there are that training, even with the heart rate variability biofeedback, helps manage the symptoms in cancer patients, which includes the anxiety and sleep disorders.
Okay.
And
We're going to have
Jason.
one more question, and we're going to take this from one of our audience members that's live streaming.
Yeah, this is a viewer on Facebook. Her name is Poon.
Okay.
Poon.
Hi, Poon.
She wants to know if a person is allergic to cats, dogs, trees, and grass, stuff like that. Can they heal themselves with this practice, with these allergies?
Well, again, I would refer to the wisdom of the body and how the healing processes of the body. And I would say the person would definitely benefit. Would it heal? I am not in a position to say that, to answer that. But it definitely brings benefits and supports the healing processes. So whatever the body is going through, and our body is designed to heal. It's designed to detox, right? It's designed to always come back to homeostasis. So if there are allergies and there is some irritation, right, going in the body, then definitely it will benefit. But I mean, the results that I cannot answer.
So, by the way, this didn't hurt at all. So I want to thank you.
Thank you.
Agnieszka Tarnawska. And Agnieszka is a stress resilience coach, Reiki therapist, and an expert in HeartMath as part of a holistic healing. And she's at Breathe Physical Therapy.
Yes.
So thank you for being with us.
Thank you so
I want to
much.
thank the audience for being with us. If you know someone who would benefit by watching this program, it will be available on demand at the Above and Beyond Cancer YouTube channel and also at the Mercy One Cancer Center website. Thanks for joining us. I hope you'll join us again next week. Thanks, everyone. Thank you.